USMLE Question 1. A 40-year-old man presents with a dark, scaly rash on his neck and face, as well as diarrhea and difficulty concentrating. He mentions that he has been feeling fatigued, confused, and irritable for the past few weeks. He has a history of alcohol abuse and poor diet. On physical examination, a circumferential rash around the neck is noted, resembling a broad collar. What is the most likely diagnosis? A. Pellagra, vitamin B3 deficiency. B. Scurvy, vitamin C deficiency. C. Vitamin B2 deficiency. D. Rickets, vitamin D deficiency. E. Vitamin B12 deficiency. Answer: A. Pellagra, vitamin B3 deficiency. Explanation: the patient's diarrhea, dementia, and dermatitis, manifested as a C3-C4 dermatome circumferential rash or Kassel necklace, are characteristic of pellagra, which is caused by niacin, vitamin B3 deficiency. Pellagra is also associated with alcohol abuse, malnutrition, and conditions that impair tryptophan metabolism, e.g., Hartnup disease. Treatment involves niacin supplementation. USMLE Question 2. A 30-year-old woman with a history of malignant carcinoid syndrome and trouble sleeping presents with a red rash and irritability. Physical examination shows dermatitis around her neck, specifically a C3-C4 dermatome broad collar rash. Laboratory tests reveal elevated levels of serotonin metabolites. What is the underlying cause of her symptoms? A. Niacin, vitamin B3 deficiency. B. Vitamin B6 deficiency. C. Vitamin A deficiency. D. Vitamin C deficiency. E. Folate deficiency. Answer: A. Niacin, vitamin B3 deficiency. Explanation: the patient's pellagra-like symptoms, diarrhea, dementia, dermatitis, are likely caused by niacin, vitamin B3 deficiency, which can be seen in malignant carcinoid syndrome due to impaired tryptophan metabolism, leading to reduced tryptophan conversion to niacin. The C3-C4 dermatome broad collar rash is characteristic of pellagra. The condition can also be associated with isoniazid and Hartnup disease. USMLE Question 3. A 35-year-old male with alcohol use disorder presents with fatigue, mild confusion, and abdominal discomfort. On examination, he has hyperpigmentation of his sun-exposed limbs and a red, inflamed tongue. He also complains of difficulty swallowing. What is the most appropriate treatment for this condition? A. Oral niacin, vitamin B3 supplementation. B. Oral riboflavin, vitamin B2 supplementation. C. Oral thiamine, vitamin B1 supplementation. D. Oral folic acid supplementation. Oral vitamin C supplementation. A. Oral niacin, vitamin B3 supplementation. Explanation: the patient has symptoms consistent with pellagra due to niacin, vitamin B3 deficiency. Niacin is essential for redox reactions, and deficiency leads to the 3 Ds: diarrhea, dementia, and dermatitis. The sun-exposed limbs are typically hyperpigmented, and the broad collar rash is a key feature of the disease. The most appropriate treatment is oral niacin supplementation.